It's been 3 years since the World Health Organization declared COVID-19 a public health emergency of international concern, its highest level of alarm. Since then, the virus has claimed close to 7 million lives, 2 million in Europe alone. But some experts say this data is an underestimation. Compared to 2020, the major element that has allowed the situation to greatly improve is the COVID-19 vaccines developed in an unprecedented amount of time. Public health expert Professor Jeffrey Lazarus says several subvariants of Omicron are currently infecting thousands in Europe and continue to claim lives. On top of that, one major concern remains for the scientific community.
We know that millions of Europeans have had or have long COVID, but we don't know exactly how many. It's one of the important pending, I would say, urgent issues for European health authorities to monitor the long COVID situation. It's very serious.
Professor Lazarus says whether booster doses are recommended to fight long COVID is still uncertain. Greece, Germany and Spain are the last European countries to make face masks mandatory in certain closed areas, but the rule is about to be lifted. Professor Lazarus warns vigilance must remain high as we are still in a state of pandemic. He adds that governments must continue to fight against vaccine hesitancy.
In spite of all the preparations that were in place, we were not ready for this pandemic, and the general population was completely taken by surprise, as were many governments. So now we know the importance of pandemic preparedness, and I think that is going to be with us forever.
Scientists warn that COVID-19 is likely to remain in our repertoire of diseases and that other pandemics are looming due to the closeness of humans and animals caused by factors such as climate change and intensive farming.